Hey everybody, Dr. Rob here, Facebook Live. Hope you're all having a great time. Hope you're all detoxing. Everybody did burpees because it is the Tuesday after Thanksgiving. Remember, we talked about that. 5,000 calories in the average Thanksgiving dinner. Let me know if everybody out there were average. Hopefully in this one instance, everybody was below average. Today, I'm going to talk about carpal tunnel. Carpal tunnel is a very interesting, a very unique syndrome. So it's extraordinarily popular, but it is also very overused in the normal vernacular of American vocabulary. So what I'd like everybody to do is punch share. Let's share it. I asked for a whole bunch of shares. We almost got them last week. Punch share, press like. Take a look, share it with your friends. It pertains to a lot of people. Carpal tunnel syndrome assessment and solutions. Basically, there are more than 3,000 cases of carpal tunnel at any one time in the U.S. Not 3,000 for the year, at any one time. It is a very popular diagnosis. It is a very popular syndrome. I will say this, as a little seedling towards the end of the Facebook Live, carpal tunnel is not as prevalent as people think it is. And we have to understand why. Nevertheless, let's go through some of the earlier things. Carpal tunnel syndrome is a common painful nerve disorder caused by compression of the median nerve. So traditionally, we think of the median nerve as coming through the neck, down and around the arm, into the hand. The true nerve, that is carpal tunnel, if you will, is you get carpal tunnel right here, not here, right here. There are your wrist bones, right there, and it's a nerve or a lateral nerve off the median nerve, which is called the recurrent median nerve because it recurs out. So it's truly right here if you have true carpal tunnel. So I use the term compression of the median nerve. The median nerve is compressed here and adversely affects what we call the recurrent median nerve. Median nerve passes between the bones and ligaments of the wrist, as I indicated over here. Remember, there are 8 bones in the wrist. Even though we think this is the wrist comes from here to here. Carpal tunnel causes numbing, tingling, burning pain in the palmar surface of the first 3.5 fingers in the tips. So it's 1, 2, 3, and half, this side of the half, and the tips of the fingers. That's traditional carpal tunnel. Here's what's fascinating about that. That's how I learned it in school. The definition has not changed. That's how all my medical, chiropractic, naturopathic, and the like brethren consider it. What's amazing is the doctors have written the book on carpal tunnel. We've all read, or at least I hope we've read the book, and the patients never have. And they will come in and talk about carpal tunnel and actually have carpal tunnel and not give that pain distribution. So you really need to see someone, and the best way to do it is have them go through some orthopedic functional tests. Try to avoid the EMGs. They hurt. You get stuck with a lot of needles. Have somebody really truly look at it and understand. Most people, unfortunately, patients, they'll say, oh, I have carpal tunnel, I have pain in my hand. It's not correct. There are specific diagnoses, there are specific symptomologies that'll lead you down the road to ascertain if you have true carpal tunnel. Signs and symptoms: tingling and numbness and feeling in the hand or fingers. We alluded to that before, so you're going to see that change. By the way, the pain and sensation change, pain and sensation change is the exact same distribution in the 3.5 fingers and the posterior tips. There is no difference between the two. In a lot of syndromes, you'll get a different sensation, nerve change than pain change. Shooting pain in the wrist or the forearm. It really has to go here. A lot of people always say they have carpal tunnel over here and here. Carpal tunnel is really in the wrist. Now, it can be caught at a couple of different areas. Like I said before, we're going to talk about that. Difficulty in clenching fist or grasping small objects. Man, you'll see people that have true carpal tunnel, they can't even hold a pen. They can't make a fist. Thumb weakness. To me, that's one of the best tests. So I usually will come in and say press, 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 and the person will go weak. You'll look right in what we call this hypothenia area, and if you'll see atrophy in here, where that recurrent median nerve works and feeds, you'll know that they have true carpal tunnel. Flaring of pain at night. Carpal tunnel is one of the unique syndromes that talks about night pain. So understand that you're going to have that distribution working in the evening. So we covered the signs and symptoms. Now let's go. What causes carpal tunnel? Number one thing, repetitive trauma. Computer. Elevate your shoulders. Computer, computer. Movement, movement, movement. There's your repetitive wrist action, your repetitive hand action. Chronic inflammatory conditions, diabetes, rheumatoid arthritis, a ganglion cyst, and gout. Any kind of inflammation. And yes, diabetes is an inflammatory autoimmune condition. Any kind of inflammatory condition will lead you down syndromes and musculoskeletal failures. The question was asked today on a podcast. I was just on a podcast 2 hours ago, and they said, do you have a higher incidence of, not to go off the rails, concussion if you have diabetes? Yes. Do you know why? If you have inflammation, you don't respond to trauma. It's micro trauma. It's small trauma. The better you take care of yourself, the better chance that you'll have of decreasing any of these kind of musculoskeletal injuries and or syndromes. Also, conditions that increase the need for B6. B5 and B6 are critical vitamins that are needed to avoid carpal tunnel. They are pregnancy, hypothyroidism, menopause, and the use of oral contraceptives. Any of these will cause a decrease, will really absorb at a higher level and have you have a deficiency in B5 or B6. Here's one of my favorite topics. Areas of possible compression. Well, is it carpal tunnel? Is it what we call double crush? Double crush means the nerve is caught at two different areas. Is it caught up here and here? Then it's called double crush. Is it caught here and here? It's called double crush. The median nerve can come through the neck and the scalenes. All your nerve and nerve roots come through your scalenes. They call that the brachial plexus. It's all your upper body nerves. So it's not uncommon for me to evaluate somebody's neck, somebody's scalenes, to touch and light them up all the way down through the nerve roots. So think of your spinal cord as your tree, your Christmas tree, to be in a holiday mood. And the branches are all the nerves that come down. The lights, those are your nerves. When you, boom, light up that Christmas tree, that means your nerves are all lit up and they're all interconnected, all from the centerpiece. That's like going through your neck and your scalenes. Your deltopectoral fascia, that's right in here. That's another area in which you can get compression to the median nerve. Ligamentum fibrosus, biceps aponeurosis, that's right here in the biceps. Real interesting that people don't realize it can get caught up here. Pronator teres. Actually, let me be a little more specific. Your bicep aponeurosis is here and goes through there. Your pronator teres is right here. Pronate. Pronate. Turn your hand over. Pronator teres has two heads. It's on two different bones. You ready? This is my pronator teres. Right there. This is the number one area where you get compression in the median nerve. This is why most people claim they have carpal tunnel, and it's misdiagnosed in a lot of doctors' offices. My shirt is my median nerve, because understand my median nerve is going to come this way as it goes around my elbow and come right into my wrist and then branch that way. Here's my muscle, the pronator teres. When my pronator teres is tight, grabs my nerve, grabs my median nerve. So pronator teres, from this movement, is one of the biggest reasons. You probably have more pronator teres syndromes than you do carpal tunnel syndromes. Flexor digitorum superficialis, which is what I actually pointed to before, which is right in here. As it comes through the pronator teres, it goes right in there. Ow, I feel it, I'm on my nerve. That's not a lot of fun as it goes through there. And of course, good old carpal tunnel. So you have multiple places in areas of compression. That is something, that's why you want to go to a functional movement practitioner, chiropractor, preferably physical therapist, whatever it is, to ascertain these different areas. I can tell you, star, pretty big up there, not as popular. The other ones just may get minorly involved. So let's take a look at some carpal tunnel treatments. Well, adjustments, why not? I don't talk about it enough. I do have a DC, I do have a doctor of chiropractic. Adjustments will help. Allowing the joint to open, allowing space, allowing mechanoreceptors. So adjustments really work. We adjust not just the spine, chiropractors, we also adjust the extremities, the wrist, the elbows, and the like. Laser therapy, low-level laser therapy, corneal laser, big shout out, nothing better. Low-level laser therapy, cold laser, class 2, because you don't want to heat a nerve. Corneal low-level laser therapy does not heat the nerve. It's actually 635 nanometers, which literature has shown to allow for what we call an action potential at the nerve, which is going to help with the myelin sheath and allow the nerve to enable itself to send its proper signals. Great results using laser therapy. Nerve floss. That, I think I'm going to do a whole Facebook Live, but there's ability to floss your nerve. So as the nerve goes through the whole body, I may be in this position here and then floss the nerve. So the idea that a nerve wants to move on its own, you can do specific nerve flosses in the office with me, and I can show you nerve flosses to release the median nerve and the recurrent median nerve at home in the office. Corrective exercise. No one's got better corrective exercises than web exercises. I use them all the time. I think we just discussed it. Big shout out to David at Web Exercises. I think he's now going to have a whole carpal tunnel. We're talking about a whole carpal tunnel little diary or dictionary of 6 to 8 exercises. So there's a tremendous amount of corrective exercises that you would want to do. Some of the biggest things, just open up. They call it the cock-up position. Open up, and I'm always a big proponent of open up and stretching, getting the thumb back so you can stretch out that median nerve. Soft tissue release, active release technique. One of my favorite. Active release is in all the major journals. It's spoken about at the highest level of sports. It breaks up muscle adhesions. I'm a big proponent of using active release for any kind of muscle adhesion and or nerve entrapment. Factor PM, big shout out to Todd Riddle. Factor I'm using in a lot of areas to open up fascial adhesions and also grabbing the nerve. Remember, he who treats the side of pain is lost. It may be compressed in a different area and nerves will be radiating down. So a lot of big shout outs on the soft tissue release. If you're not doing the soft tissue release and the corrective exercise, you're probably not going to be able to resolve what's going on. Those who have had carpal tunnel surgery, remember they cut you right here. Scar tissue is going to lie down. So all the things I mentioned with exercise rehab, laser to help with healing, and in addition, some other nutritional protocols, because you're going to get the scar tissue, you're going to recompress. Carpal tunnel surgery has not been shown to be effective in also research journals. So please consider alternative methods. In addition, nutritional protocol. There's always a nutritional protocol. B5 and B6 vitamins are critical because if you're deficient in them and they damage a nerve, clearly you want to supplement with them. Omega-3 fatty acids are a great choice. DHA being the big player. DHA has been shown to help with nerve and the nerve encasements. Hops, which is a selective kinase response modulator, berberine, and selenium. This is for soft tissue healing. That's a formulation called EC Matrix that I carry to help with soft tissue healing, a great choice. Probiotics. Well, I can tell you this, we can never talk enough about probiotics. A little FYI, we just saw that you need to actually take probiotics and now a prebiotic like a fiber because you have to feed your good bacteria. Because if you don't, even your good bacteria will turn against you and start eating your intestinal lining. If your gut is not in health, you have musculoskeletal failures. Everybody should be taking a probiotic. And finally, proper body composition. The literature is real specific. The heavier people are, the more musculoskeletal faults they have, and they have shown on a BMI for every unit that you increase, your incidence of carpal tunnel increases because of compression and fluid. So it always comes back to the same thing, everybody. Therapeutic lifestyle, watch how you eat, exercise, proper supplements. Anybody got any questions on carpal?
Yeah, a couple common questions. The first one, for someone who's spending a lot of time at the computer who experiences pain in the wrist or hand, is it carpal tunnel? Do you know? And what would you recommendations would you give?
Great question. Just because they have the pain in the hand doesn't mean it's carpal tunnel. The number one thing that we talk about is Brugger. And do you want me to show it now, or do you want to do like a little video that we can put on in addition to the Facebook Live? That was John in the back. He's reading your questions.
If it's easy enough.
Well, Brugger's real easy. So you're going to stand up. I happen to be standing, as everybody says. Arms down and back. So my scapula's in my back pocket. Retract my chin. And I open up for 20 seconds. 20 seconds every 20 minutes at the computer. Preferably stand if you can. It's this position. that's really going to hurt you within the carpal tunnel and sitting at the computer station.
And another one is for some of our CrossFit athletes who are watching along with us, a lot of pressure on the wrist and the extremity. Yes, you got that.
Right.
You mentioned web exercises. Any other
exercise.
favorites that might help?
Web exercise is a great choice. Also, guys, when you're talking about the clean position, the hold before you're going to press, go into the press position. Hopefully you have the flexibility in the area. You're going to open up. Web exercises. You guys can also take a good look at Performance Health. They have some things that would help. Get the flexibility in the particular area. Just remember, as an FYI, there can be some neural tension. Also with that position, with the bar up in the particular area where you're up in here and holding it, be careful where you place it. Because if you place it above the clavicle, you can pinch down on some nerves. And I have a couple of athletes that have actually come in. My wife's real flexible, and she hits the bar above the clavicle, and she hits the whole nerve bend. So please be careful of that.
Cool. How can they find you?
They can find me Facebook. You guys know Dr. Robert Silverman. My website is drrobertsilverman.com. Feel free to email me if you have any questions. I love all the emails during the week. info at drrobertsilverman. And please, guys, don't forget, my book is out. We're doing a great job getting some great feedback. Inside Out Health, a revolutionary approach to your body. Always yours in health, Dr. Rob.